Obstetrics and Gynecology Explained. So, what is it that we do? It takes 9 years after medical school to become a specialist in obstetrics and gynecology. Now, whenever I tell somebody that I work for this specialty, um, the light bulb question that I can see flashing in their faces is, sorry, what's that? So I thought I will make a video to explain my specialty a bit more in depth and as to exactly what we do. So after you become a specialist, you'd work on labour ward. You'll do things like cesarean sections, instrumental deliveries, suturing of any vaginal tears, and manage excessive blood loss at delivery. So these are broadly the things that, as a consultant, you would be doing on labour ward, and also helping make management plans for the high-risk patients on delivery suite, and managing the ward and keeping the work flow going, and also supporting your juniors on labour ward. You've then got antenatal clinics where you are reviewing patients who are considered high risk pregnancies. It might be because of the medical problems that these patients have, or it may be that they have developed a condition in the pregnancy that then affects the pregnancy itself, the growth of the baby, and also influences what gestation the baby will be delivered at, and also what will be the mode of delivery for the baby. So, for example, if it's a complicated twin pregnancy, a cesarean section may be offered at an early gestation to somebody who may be able to carry the pregnancy till term or even sometimes beyond. It may be that we need to involve other specialties. So, for example, if a woman has diabetes in the pregnancy, normally we would involve the diabetes specialist nurse. If there is somebody who has got a thyroid condition, it may be that we need to involve the endocrinologist. If there is a patient with a inherited blood clotting disorder or something, then a hematologist may be required, and the list goes on. As an obstetric and gynecology consultant, the gynecology part of the job would involve you to work on the gynecology assessment unit, where you review patients with heavy bleeding, ectopic pregnancies, that's pregnancy not in the right place, which is not in the uterus, so it might start growing in the tube or the ovary or anywhere inside the abdomen, hyperemesis, which is excessive vomiting in the pregnancy, pelvic infections, complications from other surgeries like hysterectomies, hysteroscopies, a LETS procedure where a part of the cervix is taken out and sent for further assessment. So all of these procedures can result in complications, and that's something that you would review on gynecology assessment unit. Gynecology clinics, which then involve things like pelvic pain, abnormal bleeding, prolapse, ovarian cysts. So, like managing these patients, making plans whether surgery is required or not, or any further assessment like scans, um, reviewing patients with cancers of the vulva, vagina, ovary, uterus, fallopian tubes, managing patients with vaginismus.